Last and certainly not least, the most important thing I think about any relationship, because culture eats strategy for lunch, and I think love starts with respect, right? You got to kind of like, there's kind of a continuum between respect, trust, and love. And if you respect each other and build good relationships together, it might lead to trust, and then it might even lead to the L word. That's an okay thing to say, that we kind of love each other and work together each other that way. The collaborative way we've worked together has been stunning. Since day one that we've worked with folks at DaVita, it's been a clear culture and conversation match. We've talked about some tough stuff, talked about survey readiness, talked about you guys have had to fix some of the issues that we found, or when CMS folks found people not wearing the PPE right, or breaks, or people not doing observing patients correctly in our hospitals, or things like that. We've worked with you in direct ways to build those relationships to improve care. We want to be sure, Joanne uses those learnings and sends out this be sure to know information about how we can improve things, so that we're staying very standard and very direct in the way we're doing things. Our policies and standards are becoming all the same, so everything can be done exactly the same for the safety of our patients. And all of our quality reporting goes all the way up to Louisville, and I hope it goes all the way up to Denver, so that when you all look at quality across the continuum, you're comparing yourselves one to the other and making sure we're constantly improving things. And I can kind of tell you're a little competitive with each other, so I presume that if Kansas is doing this and they see that New Jersey is doing that, New Jersey's doing better, you probably want to go towards the New Jersey outcome, and everybody talks to each other to make that happen. That's the way a partnership works in order to make sure we're constantly improving things for patients and families. The other thing that's, I think, a very important feature about our work is that you all are constantly available to us. In the first 1 or 2 years of our relationship, I was personally calling maybe some of you all, but certainly some of your bosses, saying, nobody showed up this morning. It's 7:05, and somebody was supposed to be there at 7. We were that on it to make sure the dialysis was supposed to start at 7 o'clock, and the dialysis team wasn't there. Patients were waiting in the hallway. You all are so responsive to that. Every time we had things like that, it was an opportunity for improvement, and I want to thank you for your responsiveness about that kind of stuff. So thank you for honoring Kindred for that.